Good morning, everyone. My name is Chen from Yale University. Thank you very much to Professor Winnie Yip for organizing such an important pre-conference workshop on healthcare reform in China. Today, unfortunately, I'm not able to come, but I would like to use the next 15 minutes to present some of our findings on the past and the present patterns of early life environments and healthy aging in China and some future trends. So I would like to also stay online for Q&A if time allows, or otherwise I'd be happy to answer any questions or receive any comments from you. Population aging has been very important in China, especially in the last couple of decades. China is aging very fast in terms of number of elderly and the sheer size of the elderly population. And the health of the older people will define the well-being of a population as it affects not only the older people themselves, but also their next generation and their families through caring needs. And the health of the older people also determines the health care costs and the social security expenditures, and also challenge the Chinese economy. If you look at this two figures plotted using the China Family Panel Study, which allow us to look at some dimensions of health over age and the different birth cohort, you will find not very promising trend. For example, the left panel shows that for most ages, the later born cohort had worse mental health status as measured by the CESD mental health measures. And also, if you look at the right panel, the mental health declined for most of the most ages over time. If we compare the same individuals who were surveyed in 2010 and compared to the same individual on 2014, you will say the decline. So it's both declining over age and birth cohort. And the same thing happened for self-rated health. So the China Family Panel Study also allows us to look over a wide range of age cohorts and also for 4 years apart for the same individuals from each other. We also find a declining self-rated health over age and the birth cohort. The picture is slightly different for cognitive health. For mathematics skills, as surveyed by the tested in the China Family Panel Study, we still find a little bit decline. Over age is a large decline, probably related to their education background, and also is declining over birth cohort. So the younger birth cohort is not doing better than the older cohort, which is worrisome. But that picture is like over a longer age cohort, but do not necessarily give us a view of linking the same individuals over the life course. So in order to do so, some studies looking at, for example, fetal origin hypothesis, which shows that aging may start in the womb and in utero is a very critical period during which the adverse circumstance may bear long-term consequence. And there's a large number of studies documenting this. And we did a thorough review of the literature. And we find that the Great Chinese Famine has been the most important types of work being done using this as an early shock in prenatal period or postnatal period. And people find consistently that health in later life measured by disability, obesity, hypertension, depression, reduced cognition and cardiovascular disease, and all this later life health are declining. Those are very consistent. But Great Chinese Famine is one exception. We don't find much other studies using credible natural experiments in China to link the two ends of the life course. This thing is very important, linking the early life environments and the old age health, because not only from the shocks, as we mentioned, the health shocks, but also from the social justice. The WHO Commission on Social Determinants of Health highlights the role of childhood environments as a primary source of unfair health inequality. And the nascent a special issue in 2017 also had discussed health equity and equality as related to the early stage of life and how that widen health gradient over the life course. And also there's political salience about this. And Franklin Roosevelt very early this also mentioned that individual ability cannot be equalized, but we should insist of trying to equalizing the opportunity at the beginning of life. So this is related to social justice, social equity. And Alan Kruger also argued that the rising inequality in the United States has been transmitted to unhealthy division of opportunity in early stage of life, and which is harmful to economic growth. So we have a number of studies trying to looking at the sources of health inequality over life course. We try to distinguish two types of health inequality. One is due to the childhood circumstance, which the children or even the fetus had no control over that. Which is something critically important for policymakers, public policy to address, because this is out of the realm of the choices of the individuals. But the other inequalities due to the efforts, for example, smoking, lifestyle choices. So if we misallocate more resources to the efforts to address that, that may lead more distortion in health behavior and lifestyle over the life course and generate large social costs. So we really want to understand how much the health, the childhood circumstance may contribute to long-term health, especially in old age. And we follow John Rimmer's approach, who is my colleague at Yale Economics Department. And he is also trying to measure the inequality due to childhood circumstance. He argues that we really need to compensate this using the limited government resources. So in the literature, we find that there's all kinds of studies linking the single childhood factors and the later life outcomes in different countries. But there's a little study concurrently combining all these factors to look at a comprehensive picture and how much the overall may contribute and manifest as health inequality in old age. So that's what we try to contribute. We link the people in two ends of life over 50 or 60 years apart from each other. And we measure comprehensive measure of childhood circumstance and also measure multiple dimensions of health. We compare conventional methods and machine learning methods to mitigate overfitting issue in the conventional methods. And we impose very little structure to the data and let the data tell which is the best model. And we look for the best prediction and forecasting model. And we use the data health retirement survey and the Chinese longitudinal survey of the health and aging and retirement, the CHAOS, to look at those two countries because they are very different in many dimensions. So we link for each country survey, we link the panel data of later measured health in old age and their life history survey back to their age 5, age 1, age 10. And for China and for the US, and we measure a number of more than 100 of childhood circumstances by age 5. And we categorize them into 7 domains according to the literature and especially the World Development Report in the 1998. And we evaluate health in the dimension of self-reported health, mental health, physical health, and cognitive health. And this shows an example of our decomposition and using machine learning, the regression tree method for the physical health. We measure physical health by the frailty measure, which is the index of the functioning of the body. And so we did this for China and the US, and from the regression tree, it can tell us the most distinguishable factors that drive the inequality in old age as attributable to childhood. And it's like growing a tree. The branch at the top shows the most distinguishable factor. So one interesting finding is that for both China and USA, parental health and health over childhood are commonly very important. So health in early stage of life can transmit into a later life. And for China alone, what's very important is that the regional and rural urban status at birth are really important. That means where were you born in China, rural or urban, which region may predict what your health would like to be in old age. This is very different for the US. There's no such findings for the US sample. And for the US, what's more important is the family socioeconomic status, especially race, ethnicity, and also early education at the household, indicated by the number of books at home. So early life cognitive inspiration really helps the individuals to develop and into their old age, and shows the divergence in their health in old age. And we did also use another machine learning methods, the random forest, to look at because random forest give us a random selection of the trees. We did 200 trees which form a forest, and which can make us the full use of the data. And we basically find the same results there. And we also did out of sample perform the estimates, and we use the training subsample to train the model, and we validate in another 9 subsamples and to find the best prediction model. And overall, we find that the random forest model outperform all other models, and which can improve the prediction accuracy by up to 30%. So which is very promising, not only consider about the outcome we measure, but potentially some diseases like dementia, we really do not have a effective cure. So early prevention and prediction of risk is really important. And using the best model, we find that the childhood circumstance may explain 26 to 38% of health inequality in China in old age. And for the US sample, is even bigger share. That means if we can avoid those divergence in the childhood circumstance, we can address like 1/3 of the inequality in the old age. So which is very surprising and very large salient. And we also find that if we use a traditional method by controlling for all these factors and decompose, it will largely overestimate. So overestimation is not good because it may mislead the policymakers to say that we really have such a large childhood circumstance to address. So we really need more accurate estimation. So the machine learning methods shows it's a very promising application. And lastly, we really want to emphasize this is not a causal study. In the future, we need to understand the mechanism, whether this inequality in later life is driven by childhood circumstances directly, or is through the intergenerational transmission of unhealthy lifestyles, some different channels we need to further distinguish in order to advise public policy. And lastly, I want to alert the audiences here is we are looking at the life course study. So people who are studying now are already 65 or older. So in the last few decades, we all know that there's rising inequality, but it's not factored in our analysis. So countries with greater economic inequality may tend to be countries with inequality of opportunity and the disadvantage being passed on from parents to children. So we already, from this figure, shows that even if we divide our sample for the elderly to different age cohort, we already find the younger cohort, actually those 45 years to 49 years old, they already have a bigger portion of inequality at that stage being attributable to the younger age, to the childhood, even if they have a narrower time window between the childhood and the current stage of life. So this is very alarming because with inequality going up, there can be even more inequality in health in old age can be attributable to childhood. And finally, China has been doing something to trying to emphasize this life course health in the Healthy China 2030 national blueprint. We already say that there's one bigger, very big major transition from disease episode to whole life cycle. So that means the government wants to manage better the population health from cradle to grave. So this is what I want to share. Thank you very much.